Hi friends, hope you're doing well. I'm Dr. Milind. So I welcome you all in another episode of Know the Branch from the Specialist. So today we are going to talk about radiology, and I'm very honored to introduce a very special guest, Dr. Nehal Singla ma'am. Hello ma'am, I welcome you to this talk session. Please introduce yourself.
Yeah, hi, Milind. Thank you for having me here. And so I'm Dr. Nehal Singla. I completed my residency from Ram Manohar Lohia Hospital in 2017. That was in radiology. And then I did a senior residency for 2.5 years in Maulana Azad Medical College, Delhi. And then I moved to UK because I got married and I had to move here. So after that, I did an observership here for a month. That was an unpaid observership, but it still opened my expertise into other fields of radiology, and I got into musculoskeletal radiology from there. And so after doing my observership, I did some research work into radiology. I published a couple of papers here and there in MSK, and then I did 1 year of fellowship in musculoskeletal radiology from one of the largest trauma centers that UK has in Birmingham. And now I'm working at King's College London.
Yes, ma'am, that's a very great journey that you had, and so let's try to know about the branch and about the field from the ma'am. So, ma'am, what my first question is, what came to your mind while selecting a branch? Like after your results, like what went through your branch? That why did you select radiology?
Okay, so I had a bit of a personal bias, to be honest. My mother is a radiologist, and while I was growing up, I only wanted to become a doctor to become a radiologist. So even during my third year of MBBS, when someone asked me, okay, what do you want to become or what field do you want to pursue further ahead? I was dead sure that either it's going to be radiology or pathology. I didn't want to go
Yes, ma'am.
fields.
So you were clear from the beginning. That's a very
Yeah,
good thing.
yeah.
Ma'am, tell us about how the radiology department works. Like, what are the work hours and how do you progress through residency? Like, what happens in the first year, second year, third year?
So I'll be very honest with you.
Yes.
So while choosing radiology, I knew that I had to study a lot throughout my life. It's not like other branches where you just learn via experience. It's more of a knowledge oriented branch where you have to be updated throughout your life because
Yes,
it's
ma'am.
a technologically linked branch. So it's still changing, it's still revolutionizing. All right. So my work hours are pretty relaxed. And I think that's the one thing that lures a lot of kids into radiology these days as well. That, okay, you just have to work 9 to 5 versus medicine where you still have 12-hour shifts or night shifts. And after a certain point, like after third year of senior residency, you might not have to do any more night shifts if you don't want to. So work-life balance in the initial phases of life is pretty great for radiologists versus other fields of medicine. Okay, my father is a pediatrician, my sister is a pediatrician, and I see the difference in the work-life balance. So the first year of residencies, radiology in MBBS isn't taught much. I don't know about the entrance exams these days, but when I gave my entrance exam, I had no idea about, okay, what I'm entering into. So the first 2 months were just getting used to the department, what all machines they are, how to operate them, how the department functions. So there are basically four broad fields: X-ray, ultrasound, MRI, and CT. And then you just get a shadowing period in each of the fields, and then you'll start to progress in these careers. So first year would be just like X-ray and ultrasound and a little bit basic CT, like the emergency CT head, CT abdomens, and basic how to scan the patient's ultrasound abdomen for that matter. By second year, it will all be supervised. You'll not be signing any independent reports because you have not been doing any of these in medicine, like during your MBBS time. Unlike a medicine trainee where you'll still have some independent responsibilities, as in putting a cannula or anything. But in radiology, everything will be supervised for the first year or so, practically in every college. By the time you enter your second year, you are expected to do some independent work in terms of X-rays, but you're expected to attend a lot of CMEs
Yes, ma'am.
so that you know what's happening around the world. You have to keep your knowledge updated. You have to read a lot. It's not just 9 to 5. That's just the department hours. Okay. You have to go home and read. Otherwise, it's all very
Yes, ma'am.
stagnant. And and the field gets very boring.
Yes.
Yeah.
So there is definitely, as a lot of students feel that there is definitely a work-life balance, particularly in the.
I think your video froze, millions. Yeah.
Okay, yes, sorry. So definitely there is a work-life balance that a lot of students are looking for. How is the
Yeah.
life post-residency? Like, how was like after MD? What are all the opportunities in India and abroad?
Yeah. So in India, you have a couple of opportunities. You can go for senior residency because 3 years in radiology training is not that much. You won't feel confident to sign off everything on your own. Although legally you still can because you have your MD degree. So I opted for senior residency where it gives you a lot of exposure in the fields, because after 3 years you get to know, okay, this system I still need some more exposure, maybe in obs ultrasound, maybe in cardiac MRs, maybe in cardiac CTs, or wherever you're doing your MD from, that hospital might not have some subset of the patients, and you'll still need some exposure.
Right.
So I feel it always better to do some senior residency. After senior residency, you're on your own. You're expected to do everything and you're a fully functioning radiologist. You can still function as a radiologist after your MD. No one can stop you. You can enter private setups. You can enter some diagnostic centers where you can start off by doing ultrasounds or CTs or MRs, whatever you feel confident with. For me, the route was to do senior residency and then decide whether to join as a consultant in a government hospital, or to work for a corporate sector, or to open my own setup if you have the investment for that. And the investment is a lot in radiology because the machines, the MRC, the ultrasound machines, they're already very expensive and the maintenance cost is also very high. So that's one thing that you should have in mind when you're thinking of all these
Yes,
things.
sir. Ma'am, what about this? Like, there are some super specialty courses and fellowships are also available. Is it must that you should go for it, or just being a radiologist is
It
enough?
it's not actually must that you need to do it, because the demand for subspecialization in India is still pretty low, even in cities like Delhi. But it always adds a added advantage to your resume if you have a certain subspecialized skill, and then it gives you a direction. Okay, I am interested in this field. Say radiology would be like pelvic imaging,
Mhm.
if you are into fetal medicine and everything, or musculoskeletal, or cardiac, or neuro, or GI. And then it gives you a direction to build your career upon on that front only. So I would say if you have the opportunity of going for a fellowship, you definitely should. And I think it will, personally, I think it will grow in the coming years, because I can see the rates the fellowships are rising,
Yes, ma'am.
even in. So a lot of people, even in government setups, are introducing more fellowships, more subspecialized programs. So there should be, you should have another year after your residency to pursue some subspecialty at least.
So, radiology is considered as a like relatively end branch, but ma'am, as you said that it's up to one's like what one want, because as per your journey, you have been learning throughout. Like after your residency did not stop, you kept doing better and better things. I think that will also be a message for a lot of students that it's up to you and there is no limit of learning.
Yeah, there's definitely no limit of learning. You can always learn even at the age of 60 if you're in medicine. But for me, the thing is, it is considered an N branch right now, but it might not be 5 years down the line by the time people who are entering into residency and they're looking for jobs. So you have to think 5 years down the line. So it's always better to have some sort of specialization planned in your mind. Even if it's for 3 months, it's always good to have that.
Ma'am, one more question that currently I have seen, like in recent years I have seen that is coming into the minds of radiology aspirants. About one is about the saturation in the branch, and one is about the artificial intelligence being a threat for a practicing radiologist. So, what is your opinion on that?
Okay, so there are two things. The artificial intelligence is not going to be a threat because every single branch is dependent on radiology. Nothing can function without radiology, and there are not enough radiologists in the country or doctors in the country. you can still feel that bigger cities are getting saturated, but in the smaller cities, we still get a lot of telemedicine or
Okay.
teleradiology.
Yes, ma'am. Yes, ma'am.
So, yeah, so artificial intelligence, it's actually proving to be a helpful tool to radiologists. And I think like for the next 30, 40 years, it's still going to be helpful. It might be a threat after that, but right now it's actually beneficial. And the other thing why artificial intelligence can't be a threat is if something goes wrong, they still need a radiologist to sign the report,
Yes.
because who's take responsibility of the
Exactly,
patient after?
exactly. Very valid point, ma'am. That you cannot blame it on artificial intelligence. You'll always need a screen. Yes, ma'am. That's a very good point, ma'am. Thank you. Yes, definitely.
So even if it's going to be machine oriented reports, you still need someone to look at the image and then sign
Very
it
true.
off.
Very true.
So it might create less demands, but there's ample of workload, so it's not going to be a problem
Very good.
anytime sure.
Very true.
And regulation, I would say like bigger cities are definitely getting saturated, and I would say it's not just for radiology, it's for
It's for
every
all
other
the
branch.
branches. Yes, very true, ma'am. Even as a pediatrician, I can say that the branches are getting saturated in cities, but it's up to
Yeah.
one's potentials and skill. You can always rise above the competition.
Yeah, and that's where the subspecialization comes into
Something.
factor, that I have this added skill. What are you going to give me?
Exactly.
I'm better than.
Very true, ma'am.
Yeah.
Ma'am, one more question about as you have worked in Delhi, a lot of students have this dilemma that they want to pursue a branch like radiology, but they are a mid-ranker in NEET. So they are getting DNB in city like Delhi, like Gangaram Hospital or other good hospitals, they offer DNB radio. So ma'am, is it a wise choice to settle for like MD medicine in a in a good college or DNB radio? What is your opinion on that?
So that would be a very personal choice. One, why do you want to pursue radiology? Do you even want to pursue radiology, or are you just taking radiology because you're getting DNB radiology in Gangaram versus MD medicine in Rohtak? Second thing, are you ready to go to Rohtak? And the third thing, which a lot of people might not think about choosing radiology college for that matter, if you're set. So you need to understand before choosing in your college whether the place has MRI exposure or not, whether the place has CT exposure. I would not name any colleges right now, but there are a lot of big colleges who do not have facilities for MRI, and that's a big setback in this age for training in radiology. So that should be more important. And as of now, MD and DNB are considered equivalent, but then as you have to decide what your bigger goal is, whether you want to work in a corporate hospital, whether you want to work in a diagnostic center and just earn money. And if you have the potential, nothing's going to stop you, even if you do DNB radiology. So I would not say that choosing DNB radiology over MD medicine is a wrong choice, but then you have to be clear why you are going into radiology. And I would still say that sometimes MD radiology versus DNB radiology is better, like just because it looks better on your CV.
Mhm.
But then you have to make sure if the place doesn't have an MRI machine, you have to make up for it on your own.
So that because some students have this feeling that they are getting MD radio diagnosis in a very remote place, like in a peripheral, but they get DNB radio in a good metro cities. So this
Yeah.
point is there, just to go for a degree or as you said that having a MRI and other.
So then it would be definitely DNB radiology if it's MD radio diagnosis in a smaller city where they don't have any facilities. I mean, you have to look whether the MD radio diagnosis degree from that college, like the particular college, is going to add value. It might be from a bigger place as well. Like some big hospitals, they might not have their eyes working just for like 2-3 years by the time you're doing your residency.
True.
But just the name of that college might add more to your name than the DNB radiology. But if it's from place, then you should definitely go for DNB radiology at a bigger place, and then see how people there are forming their careers.
Yes, ma'am. I definitely this is going to add a lot of this light. This will be a guiding light for a lot of students because, ma'am, A lot of students have a very good rank, as people say that sometimes it's easy to crack exam, but once you get a very good rank, it becomes difficult to choose a branch, and a branch like
That's
radiology, which is always in demand.
yeah.
Branch.
Is the most part of getting into the college
Yes,
than the exam, because we in the medical college in MBBS we don't have to really choose our branches. We just need to choose a college.
yes, ma'am.
But when we enter our MD, it's college, branch, everything, and the place. Yeah.
And radiology, ma'am, being the one of the, I mean, it's the most attractive branch for a lot of students. So it's always, like feeling of fear of missing out. What if I leave radiology? So thank you so much, ma'am. You have enlightened
And I
about
would,
it. Yes,
it's like very lucrative. A lot of people feel dissatisfied after entering radiology, that because you don't really get to connect with the
yes,
patients.
ma'am.
There would be no thank you treated me, versus the feeling that you get into clinical branches like medicine or pediatrics or surgery. So especially for people who are into medicine just for treating patients, they feel very dissatisfied when entering into radiology. So it should be very, very carefully chosen, because if you're not motivated when you are into radiology, then things go downhill very fast.
Yes, ma'am. Very true. Thank you so much, ma'am. I mean, it was very interesting conversation, and we got to know a lot of points and a lot of things, and definitely this is going to form a guiding light for a lot of students who are aspiring to be a radiologist. So thank you so much, ma'am, for sparing this time for us and guiding us.
Happy to take on any further questions if
Yes, ma'am.
yeah.
Thank you, ma'am. Thank you.